Here are 10 things you probably didn't know about dengue. Number 1. There is currently no specific treatment for dengue. Some claim that extract from a papaya leaf can treat dengue, but research is still being done. For now, only general treatments can be used to manage symptoms and make the disease more bearable until it runs its course. However, ibuprofen and aspirin should be strictly avoided as they can increase bleeding and risk of complications. Number 2. Dengue is sometimes referred to as breakbone fever. This name comes from the severe pain experienced by dengue victims, often involving the muscles and joints. Number 3. Dengue is caused by mosquitoes. A virus known as the dengue virus is carried by 2 types of mosquitoes, Aedes aegypti mosquitoes and Aedes albopictus mosquitoes. Once bitten, the virus is passed on to our bloodstream where the disease is developed. Number 4. Dengue symptoms imitate flu symptoms. Because of this, dengue can be easily mistaken as a severe strain of the flu. The most common symptoms include a sudden high fever, headaches, rashes, nausea, and joint or muscle pain. Number 5. Dengue is not a contagious disease. In other words, if you have dengue, there's no chance of passing it on to anyone else. The only way to contract the disease is by getting bitten by an infected mosquito. Number 6. Dengue can be fatal. In fact, it's a leading cause of death in tropical areas of the world. Luckily, the majority of cases are mild, but severe cases, known as dengue hemorrhagic fever, may cause shock or severe bleeding that can lead to death. Usually with prompt medical care, chances of death decrease significantly. Number 7. There are actually 2 types of traditional dengue. The first is called dengue fever, and the second, more serious condition is called dengue hemorrhagic fever, also known as DHF. Dengue fever comprises the majority of dengue cases and usually has intense flu-like symptoms. DHF is a severe version of the dengue fever that can cause internal or external bleeding that can lead to shock. With medical care, only 5% of DHF cases result in death, but left untreated, the death toll increases to about 50%. Most often, DHF occurs when a person has contracted dengue fever before. Number 8. Immunity does not occur. It's sometimes believed that if you've had dengue once, you become immunized against it. This, however, is not true, and you can contract dengue twice or more in a lifetime. There's also no vaccination available, so the only prevention for dengue is to avoid areas where dengue-infected mosquitoes are present. Number 9. There is currently no known cure for dengue. The only option is to wait for the disease to run its course, which can take up to 2 weeks. Number 10. The mosquito that causes dengue is common in nearly 100 countries across America, Asia, Africa, and the Caribbean. Cases occurring in the United States are rare, but not unheard of. Worldwide, millions of cases are documented yearly, with close to 1% of cases resulting in death. I hope you enjoyed that video. Have you had experiences with dengue? Tell us about it in the comments below. We'd love to hear what you have to say. Thanks for watching.